Hi everyone, welcome to iMumz Ask Me Anything session. So you've attended more than 230 sessions, and today we have with another interesting topic and guidance from a very renowned gynecologist. So I'll quickly introduce her, Dr. Aditi Nadkarni. She is an infertility specialist and an endoscopic surgeon, apart from being a very cool gynecologist and obstetrician, right? So she is the director of Evacare Fertility Centre in Vapi, and she has done so many IVF pregnancies. I think 3,000 plus successful IVF surgeries to her name. So we are very excited to have you, ma'am, and all over to you.
Yes. Hello everyone, and hi Ansuya, and hello. I'm Dr. Aditi, as Ansuya told you, and today I'm going to speak on important 10 questions related to your pregnancy. So, some important questions which my patients come across and they put it forward to me. I would like to share it with our special moms who are in this iMumz app. So, one of the most commonest question which I come across first is diet. What should we eat during pregnancy? So during the first trimester, it is a very difficult task to really tell the patient what to eat because she's going under excessive vomiting sometimes, nausea sometimes. So the first trimester is little difficult. We know that eating and drinking is challenging during this time, but the most important thing is you have to stay hydrated. So you have to try and drink a lot of water each day, at least 3 liters minimum of water each day, and have at least 5 portions of fruits vegetables a day so that they carry good amount of vitamins minerals. Especially fresh fruits are always better, and you have to also eat the skin. Don't remove the skin, the chilka, what we say, so that you get good fiber in your diet and you get good roughage. So that will also help you to fight against constipation. Then you can have some portions, 3 to 4 portions of carbohydrates. So basically you should have a balanced diet. You should have carbohydrates, things like maybe some bread, cereals, rice. Okay. So of course if you have diabetes, then yes, you should not have rice, but on a normal pregnancy, yes, you can have whole grain wheat etc. Make sure that you have adequate amount of vitamin D in your diet. So your dairy products should also be contained, which contain good amount of calcium. For example, you can have yogurt, you can have milk, you can have cheese. So that will take care of your dairy products. And of course you should also have a little bit of natural vitamin D, so you should also have some bit of sunshine. Of course you should use sunscreen, but yes, so you will get good amount of vitamin D through your diet. So basically a balanced diet, that is what really counts, and it will help your baby to grow well there inside. Okay, now coming to our second question, how much weight gain is expected during a pregnancy? So on an average, you can say around 20 to 30 pounds per pregnancy. If you have a singleton pregnancy, of course, that amounts to around, you can say 9 to 15 kgs from Indian point of view. And the weight gain is, especially it takes occurs more during the second trimester and the third trimester. The first trimester usually, because of excessive hyperemesis, sometimes you may not gain weight during the first trimester. So don't worry about that. The baby is still growing inside you. So the second trimester and the third trimester play a pivotal role in weight gain. So that is one thing. Yes, and the most important thing is if you have excessive weight gain, sudden weight gain of, you can say, around 3 to 5 kgs in 15 days, then it is not a good sign. It is a danger sign. You have to look for any signs of getting pregnancy induced hypertension. So you have to keep checking your blood pressure for that. So that excessive weight gain is, you don't have to be very happy about it, but you should monitor your weight gain during your pregnancy. Okay, now coming to the third important question, what exercises can I do in pregnancy and how much and when. So exercises should be actually done during pregnancy. It's not that you should not exercise at all. So the thing is, if you are already an athlete or if you are already doing your routine exercises, don't stop doing it, please. You can do gymming also, but not very, very excessive, strenuous activity so that you get, discomfort. But you can just squeeze in some forms of exercises. Some you can do cycling. You can also try and aim at about 150 minutes per week of exercise, so that you could do a little couple of little walks per day. You can also have some yoga. You can have some breathing exercises. You can also you can do any bit of exercises which will help the baby to grow. You can, and in the last trimester of pregnancy, you can also do pelvic floor exercises which will help you to frame your pelvic floor muscles. They'll get better, they'll get stronger, and it will help you to get a vaginal birth. So that is the third question which I told you. So the most cute question which we come across is, when will I start feeling my baby kicking? So the baby will usually start kicking at your 18 to 23 weeks of pregnancy. So don't worry. During the first trimester, it is very unlikely that your baby will move. Whenever you feel that it is moving at 12, 13 weeks, it is sometimes little psychological, but your actual movements, it's also called as a baby flicker, or you can say it's quickening. Quickening is the baby has started to move, it has started to kick, and it has started its particular hand and leg movement, which will definitely get you a feeling that yes, the baby has started moving. So it usually occurs, the quickening occurs between 14 to 26 weeks of gestation of your pregnancy. And after that, you will have your first little flurries. You will get to know that your own baby's pattern of movements. So when you are happy, the baby will kick you. When you have eaten something good, which the baby is very fond of, maybe the baby will kick you. So you have to keep a track of movements, because in the last trimester of pregnancy, it is very important that you keep a note, you keep a chart of fetal kick chart, so that you come to know if the baby is doing well inside. Sometimes in the last trimester of pregnancy, you may feel decreased fetal movements or excessive fetal movements. That is really important. If you feel so, you should definitely show your gynecologist so that the baby inside is perfect. Then the gynecologist will undergo a non-stress test for you, that is NST. So NST will tell you what exactly the baby inside is going through. If it is giving you a good, perfect NST chart, then you need not worry. So these are some things about quickening and about fetal movements. Coming to the most hot topic nowadays, that is COVID in pregnancy. We come across so many patients coming with us with fever, with chills, with nausea, vomiting, diarrhea. So now in the second wave of COVID, I would suggest all of you all to be very, very careful, because the second wave is taking a very bad picture, and it is really giving us tremors, because it is worse than what had happened in 2020. So during COVID, during pregnancy, vaccine, should we take the vaccine or no? So now, right now, the government has not given any norms or said yes to advocate a vaccine to a pregnant lady, for reasons we all know. Because especially whenever there is a vaccine trial, the pregnant and the breastfed mothers, they usually undergo trial at the last. So first the normal patients, and then in the old age patients, the geriatric population, and the last come pregnant and lactating mothers, because they comprise of a good population, and they comprise of two lives. So we cannot play with two lives. So right now it's not easy. You cannot say whether you should take the vaccine or not. But though many organizations like FOGSI, like different other organizations have said that yes, it is safe to take the vaccine, because it's not a live vaccine. You may get a little bit of febrile, but yes, it is not completely contraindicated during pregnancy, and also during breastfeeding. Of course, that's not the topic for today, but yes, if you are breastfeeding your baby and you have completed 40 to 45 days post feeding, so you can definitely take the vaccine, because it will really help you to combat the disease, the severity of the disease, because especially the second wave is taking a big toll over young patients also. So that is about COVID and vaccination. Now we come to the sixth question. Intercourse during pregnancy. Is it safe? When should we do it? Should we do it? The frequency, etc. Yes, it's a very it's a very practical question, and I pity the husbands, because they usually they feel shy to ask this question. But yes, it's a practical question. You can't just keep one husband without intercourse for almost 9 months of pregnancy. So I feel intercourse is should be allowed, at least during the second trimester it's okay, and during the third it's okay, and in the first it is usually not advised, for reasons because the baby is still small, plus you may get bleeding, you may get pain, etc. So second is okay, it's safe. Maybe once in a week is perfectly all right. Third, also they say that in the late trimester, if intercourse could also cause contractions. So if you are very very keen for a vaginal birth, yes, definitely intercourse may help in some or the other way. So intercourse is absolutely physiological, and yes, you can definitely do it during pregnancy. It's not completely contraindicated, except in special pregnancies like patients who have a bad obstetric history. I would never I would never advise the husband to do an intercourse, especially in patients who have had a short cervix, who have had a cervical encirclage done on them, or if the patient is an IVF pregnancy, a precious pregnancy, or if she's carrying a twin pregnancy or a multiple gestation, twins, triplets, etc. So I don't think that intercourse is a good idea for such pregnancies. Okay, so coming to the seventh question, important, constipation. Constipation during pregnancy is absolutely a common problem. It especially happens in the first trimester, because of it's usually because in important pregnancies and precious pregnancies we give a little bit of higher dosage of progesterone hormone, which may be the cause of constipation. Plus, because of your diet, you should have a good roughage diet, you should have a good fiber diet, so you can combat constipation. If you still have constipation, maybe painful passage of stools, because of that you may also develop fissures, you may also develop hemorrhoids, piles during pregnancy, and then you may not have any treatment for them, because basically during pregnancy you should avoid doing any other surgeries, like for example a dental surgery or a tooth surgery or a root canal treatment. Same like with the perianal surgeries, you cannot do them because they are very painful, and any painful stimulus is not good for a pregnant lady. So I would suggest, to combat constipation, drink a lot of water, drink excessive water. Even though you may have to go and pass urine multiple number of times, that is absolutely important. It will help you to get through the pregnancy, get through the constipation. Also, it will avoid you from getting recurrent urinary tract infections, which is again a very important topic. Urinary tract infections usually occur because pregnancy is an immunocompromised state. So if you feel that you're getting this infection over and over again, it is basically because you're pregnant. So drink water, drink you can have good fluids, you can have coconut water, you can have different fresh fruit juices. I usually don't advocate canned juices and any canned liquids. So it is always better to have fresh fruit juices, etc. So that we end with the constipation part. Now coming to bleeding or spotting during pregnancy. So this could be a very common sign during the first few trimesters of pregnancy. It is also called as implantation bleeding. So during the implantation or post implantation, you may get this bleeding, which is a very common thing. So if you get little more than what you are expecting or you are seeing, you obviously get you get scared. So you have to definitely show your gynecologist. So we may have to admit you to the hospital, we may have to start you with some injections, some injectables, because we have to find out the cause of the spotting or the bleeding. It could be because of some infection, or sometimes if you have a low lying placenta, that is your placenta is on the lower edge of the segment, lower uterine segment, you could have bleeding, spotting for almost more months during your pregnancy. So you should be careful, especially in patients who have placenta previa. That is, the placenta is completely covering the cervix. So you don't have any option, but yes, you have to take complete bed rest. You should avoid traveling. You should not indulge into strenuous exercises or strenuous activities, and you should not do intercourse. So that is one thing during bleeding and spotting during pregnancy. Now coming to what are the danger signals in pregnancy. So usually these danger signals have to be taken care of in the last 3 months of pregnancy, especially in the last month of pregnancy. The most important thing, the most commonly seen things during pregnancy induced hypertension, that is BP. When your blood pressure increases, you have to be very careful. If you have pedal edema, that is your legs get swollen, they get swollen like an elephant's leg. Or suppose if you get headaches, you get recurrent headaches, you get blurring of vision, okay, and if you feel little epigastric pain, that is, you may feel it's because of hyperacidity, but you should be 100% sure that it is hyperacidity and it's not because of pregnancy induced hypertension, because these are the important warning signals of pregnancy induced hypertension, which may lead further to preeclampsia. Preeclampsia is very, very high, super high hypertension, which will lead to adverse effects on the baby and on the mother also. So for these things, if you have, these are some danger signals, like as I told you, pedal edema, headache, blurring of vision, and epigastric pain. Epigastric pain is just like you feel some burning sensation and some esophagitis. So these are important signals. Plus, if you feel lot of thirst, if you feel lot of if you micturate, if you urinate very often, you have to definitely check for your sugar levels. Sugar levels could increase, that is gestational diabetes mellitus. Pregnancy induced diabetes is also, it's become very common nowadays because of steroid usages. That is very important. You have to take a note of it. You have to check your HbA1c levels. You have to do your glucose tolerance test, or you can also do your fasting blood sugar levels and postprandial blood sugar levels, that is after having your food. You have to check your sugar levels 2 hours after having your food. So either whichever your physician advises you, your gynecologist advises you, it is fair enough. And your HbA1c levels should be within normal limits. They should be less than around 5.6. More than 6 is still okay, but during pregnancy you have to be very careful. You can't have a high HbA1c levels. And most important thing is, if any of your parent, either of your parent is a diabetic, you have to be a little more careful, because there are little more chances of you getting diabetes during your pregnancy and also post pregnancy, that is after you deliver. So these are different danger signs in pregnancy. Now coming to my last question. Will I have a vaginal birth or a cesarean birth? That is also one of the most common questions which I have come across. It surely depends on you. It surely depends on your baby, and that will be decided on the day of your delivery. Okay, you cannot predict per se. Yes, a vaginal birth can be predicted. Supposedly, if you have a good amount of vaginal space, if your baby weight is not too big, if your baby is too huge, due to many other reasons, it could be familial also. So it depends on the weight of the baby. It depends on the pelvic floor muscles. It depends on your own strength. It depends on your own might. Okay, so if you really want a vaginal birth delivery, yes, you can have it, but there are some important indications of also, the doctor advising you to go for a cesarean delivery. So the doctor usually usually gauges your cesarean delivery according to the indications, and we are almost always we really go for a vaginal birth unless there are important and whether it is indicated, only then. So indications for cesarean could be a twin gestation if you have a twin pregnancy. Just like I said, if you have hypertension during pregnancy and your BP shoots up like anything, you cannot wait for a vaginal birth. Then suppose if you feel that there is cephalopelvic disproportion, that is your baby is too huge and your the birth canal is little narrow, okay, so you cannot wait for the baby to get stuck, so you have to have a planned, maybe a planned cesarean section delivery. Sometimes you can also have a second stage cesarean section, like you feel that the baby will deliver vaginally, but at the end moment the rotation of the head, which should occur physiologically, which is important for a vaginal birth, it may not occur, it just doesn't occur. And howsoever you try, sometimes even forceps delivery or a vacuum delivery could be detrimental for the baby. It could cause long term uh, you know consequences on the baby. So usually instead of having a very painful instrumental delivery or something which will the baby will suffer in the long run, I think a cesarean birth is far more better, and it is far more easier for the obstetrician also. And of course, as I told you, that we all usually go for a normal vaginal delivery, and only if it is fairly indicated we usually advise our patients to go for a cesarean delivery. So these were a few important questions which I thought were important, and I felt like sharing with our moms here on iMumz app. And I hope I could answer important questions.
Yes, ma'am.
Yeah,
Thank
so
you
yeah,
so much, ma'am, for answering all those questions yourself. But then
yes.
now I'm going to bombard you with more
Oh,
questions.
sure, sure.
So,
Shoot, shoot.
Seema is saying, my gynecologist has told me that I have a low-lying placenta. What should I
Okay.
do to make it better? 22 weeks pregnant.
Okay, so since she's 22 weeks pregnant, she has a low-lying placenta. It also depends whether it is on the anterior portion or the posterior portion. Because if she has it on the anterior portion, then, and sometimes if it may or may not migrate upwards, it all depends on the uterine size. So if it migrates upwards, then you need not worry about it. But right now, since it is low-lying, she has to ideally take good, adequate bed rest and no traveling. And of course, now during COVID times anyways she should not travel, but moreover because of low lying placenta she should not travel, she should avoid intercourse, and she should not indulge into any strenuous activity. And if it migrates in the third trimester, then she can definitely have a normal vaginal birth delivery. But if it still remains downwards, and if it is more on the anterior portion, then there are little bit more chances of she undergoing a cesarean delivery.
Thank you, ma'am. Ma'am, Neeti is 13 weeks pregnant. She says her cervical length is 3 centimeter, and the doctor didn't give her any progesterone injection or tablets. So she wants to
Okay.
know, should I consult another doctor?
3 centimeters and 12 weeks, right? Yeah. So that is means she, and if it's her first pregnancy, and if she doesn't have any history of any bad obstetric history, then I think she need not take progesterone, because now in the fourth month, anyways, placenta takes over. Placenta is the placenta will take care of the baby unless she has any discomfort, unless she feels that she needs to take medication. If she's a working mother, if she's going to work, then she should ideally take some progesterone vaginal pessary just for some few days till she till the placenta takes over. Otherwise, 3 centimeters is a good size, it's a good length. If the size or the length goes below 2.5 centimeters, then yes, she will need a cervical encerclage, that is a stitch on the cervix. Okay, so a stitch on the cervix, a stitch in time saves nine. So if at all the cervical end goes little further less, then she should advise, she should, consult an obstetrician or gynecologist, and take the necessary precautions, only if the length decreases. And yes, also use a progesterone vaginal pessary, because progesterone will definitely help her to uh, for a quiescent uterus.
Thank you so much, ma'am. Ma'am, you mentioned that bleeding and spotting is a common question. So Shweta is asking. She's 5 weeks pregnant. So this week she has started spotting. So she wants to know if it is normal, and she's a little worried. So
Yeah. So Shweta, if have you done a sonography? That is very important, because spotting may have different reasons. First is you have to confirm whether it's an intrauterine pregnancy. So if you have confirmed that's an intrauterine pregnancy, then you need not worry. But you should take adequate bed rest. If the spotting increases, you should definitely get admitted and start the necessary medications. Secondly, if you feel that the spotting is increasing, it could sometimes be a little bit of implantation bleeding. And why I told you that you have to confirm it on sonography, sometimes in rare situations, you may have an ectopic pregnancy. That is, you may bleed or you may get a spot even if the even if the pregnancy is not inside the uterus and it is extrauterine. That means I'm not trying to scare you, but yes, this is a fact. An ectopic pregnancy, that is an extrauterine pregnancy, a tubal pregnancy, can also give rise to the spotting which you have explained. So you have to be very, very careful, especially in the first trimester of pregnancy. You have to confirm the gestation is inside the uterus, and then you can, of course, your gynecologist will give you adequate medications to stop your spotting. Okay. And there's an important medication called dydrogesterone, which is a very important, a good progesterone, which will definitely help you to stop the spotting. Okay. A very important name, which is usually you can get it, is dufaston. So that is one thing which you can take, and it will stop the spotting.
thank you, ma'am. Ma'am, I see a query regarding vomiting. So, when does it stop, basically? And also, Jaya says, water's taste makes vomiting worse. Can I have something else instead of water?
Yeah. So, as I already told you, vomiting in pregnancy is a very, very commonest hassle which our pregnant mommies come across. It usually occurs during first trimester of pregnancy. Sometimes, if you are really unlucky, it may persist till 9 months of pregnancy, and that is really, really sickening and really, really, it's intolerable. But yes, there are many ladies who have come to me saying that pani nahi acha lagta hai, just can't take water. So yes, you can take hot soups. Okay, you can have a lot of coconut water, you can have buttermilk, you can have milk, you can have curds. So something, and you can have something which is, you can have juices. So you can have something liquidy. If you don't feel like having water, you can definitely have some liquid content which will take the charge of water instead of just drinking water. You can have energy juices, like you can have simple glucon C powder or enerzal powder, which will give you vitamins, which will give you important minerals. So that will suffice. So okay, not having water will also be fine as far as you are taking important fluids.
Thank you, ma'am. Ma'am, Smita has a question for you. You mentioned that heartburn is a common pregnancy problem, right? So she
Yeah.
wants to know, is there any medication or remedy for her? She's 34 weeks pregnant and
Okay.
unbearable heartburn for her.
Okay. So, Smita, especially 34 weeks, your tummy must have grown in size. So, whenever you have some food, basically your interval period, your digestion period takes a longer time in pregnancy. So, on an average, if it would take 2 hours or 3 hours, in pregnancy, it takes 4 hours to 6 hours to digest. So that usually happens because of the progesterone hormone. It takes a longer time for your digestion to occur. So the thing is, how you should avoid getting gastritis or hyperacidity. First and foremost, have simple food, ghar ka khana. Secondly, avoid junk food. Don't eat very spicy food. Don't eat very oily food, and food which has a lot of ghee in it. So all these things will avoid you from getting a reflux. Reflux means the food comes back and you feel pukish. So such foods have to be avoided. And if you feel you get a lot of gastritis, you can definitely have things like and antacids. Like you can have a pantoprazole with a domperidone, or you can have simple gelusil or Digene. Those things will also help you out. And now I won't suggest you to take ice cream, especially in the COVID times. No, no. I'm strictly telling all my patients, please thanda, no, not to have ice creams, because of thoda sa bhi, if you fall ill and you get a little bit of sneezing, and if you feel if you get cough and cold, so no having uh, cold items. But yes, you can have these antacids which will uh, help you to prevent getting gastritis and hyperacidity. And have your dinner a little earlier. So if you are sleeping at around 9ish or 10ish, you can have a little early dinner, maybe by 6, so that the time period between the food you eat and the sleep period will vary and will differ, and you won't get a reflux.
Thank you, ma'am. Ma'am, there are a few users complaining about back pain in different weeks of pregnancy. They also want to know, why does it happen? So yeah, these are
Yeah,
the
back
two
pain
questions.
is usually our Indian ladies, Indian women, they are very, very lazy and they are very poor eaters. Okay, they don't eat calcium, they don't drink milk. Recently I was watching the movie Saina, and Saina, she used to drink 1.5 liter doodh every day. Can you believe it? Itna ki her coach had to tell her ki please stop drinking so much of milk. So you need good calcium for your bones. So basically, because of poor eating habits, you don't eat proper food, you don't have calcium in your diet. Maybe a pure vegetarian diet may also affect it. So you should have good amount of calcium in your diet. You should have ragi, you should have natsani in your diet, and you should eat if you are a non-vegetarian. Yes, you should have good amount of chicken, fish, mutton, whatever you like. So that will help you to build up the calcium content in your body. So if you have a good calcium content and vitamin D3 both, vitamin D3, now we suggest that you should take it once in a week till full 9 months. Also, it's safe, not an issue. So you should take vitamin D3. You should have calcium in your diet. So that will definitely help you to avoid getting back aches and back pains. So if you get back aches and back pains, definitely you can have some remedies. Like you can have little bit of fermentation. For that you can apply some Volini gels or diphenol gels for that, so that you can have little bit of local application gels which will help you to uh, uh, prevent such back pains. And most important is, it also happens because there is no exercise. So you should definitely, you should not keep your body lazy. Pregnancy hua to that doesn't mean you should just sit and no exercise. So all work no play makes Jack a dull boy. You should definitely exercise. You should definitely do back stretching. You should do your full body stretching, which will definitely help you to not get backaches. And that is one thing which, that was a very important question. I wanted to add it, but then I was overshooting my question. So good, I'm happy somebody came up with that question of backache.
Thank you so much, ma'am. Ma'am, Tanvi has a question for you. She says, ma'am, today I had an appointment with my gynecologist regarding Tdap vaccine. I'm finding it difficult to locate it in Amritsar as it is not available in the government and private hospitals here. Please, could you let me know the proper name of the vaccine and the dosage that I have to take?
Yeah. So, Tanvi, right? Yeah, Tanvi, you have to take 2 dosages of TDVAP vaccine. So, it is basically here in Gujarat. I'm basically from Vapi, Gujarat. Here we have it as TDVAC. So, it comes in the strength of 0.5. So, you have to take it and at an interval of around 1 month to 1.5 months. So you have to take total 2 dosages of the vaccine. If you are not finding it anywhere, you'll definitely get it in some other city. So don't worry. The only thing is just see to it that it is maintaining the cold chain. The vaccine should be having a good cold chain, and don't take it if the vaccine is exposed to sunlight. And if you are not able to get it, by just in case, there is one more vaccine called as Boostrix that you can take in the 7th or the 8th month of your pregnancy, and that will cover up everything. So then you need not worry, and you need not means TDVAC if you are not able to get or purchase in Amritsar. Don't worry, you still have a chance to take Boostrix. Okay.
Thank you, ma'am. Somebody has a question related to this. When do I get this TDVAC injection? I'm 15 weeks pregnant.
Okay, so usually what we do is we give it at during the 4th and the 5th month of gestation, or you can take it during 5th and 6th month of your pregnancy. So that is the time when you can take TDVAP vaccine. So that will be covered during that time. So usually when the patient comes to us for an anomaly scan or a targeted sonography, we make it a point that at that time we administer the TDVAP vaccine to the patient.
Thank you, ma'am. Ma'am, Akhila is 7 weeks pregnant. She says, I have allergy to some food items and pollution, due to which I use Budamate 200. Is this safe during pregnancy? Budamate.
Okay, steroids. Okay, and how much dose is she taking?
200, I don't know. She says 200 mg, I think.
Okay.
And she wants to know if this is safe during
Steroids, long-term steroids, they cause gestational diabetes. So they may cause diabetes in the mother. Okay. So she should not be ideally taking it for a very, very longer time, because that will cause steroid-induced diabetes, and it will also, it will also cause her steroid-induced eye problems. So she should avoid taking it, and unless somebody has asked her to take it, I think she should avoid taking it for such a long time. So for allergies, she can definitely, if she has some allergic component, she can simply take either she can take cetirizine, which is also safe in pregnancy, unless cetirizine doesn't make much of a role in her case. But steroids, I feel she should avoid taking steroids during pregnancy. Is she taking a puff? Is that inhaler which she's taking for? Is she does she have asthma? Asthma?
Okay, Akhila, if you could reply, then we will come back to the question again. Okay,
Fine.
ma'am, Jyotsna has a question for you. She says, does baby movement reduce when mother has fever? I'm down with COVID and baby movements have reduced a lot. She's
Yes.
25 weeks pregnant.
Okay. So first of all, Akhila, I wish you a very speedy recovery. Please take care of yourself. Hydrate yourself very well. And yes, during fever, not just COVID, during fever per se, because you are having a temperature, it definitely affects your circulation, and the baby is also affected in some or the other way. So that could be one of the causes of your baby not moving, that frequently. So just keep a watch on the baby movements, because fever is not a very good, thing to happen during pregnancy. Fever could cause adverse effects on the baby also. So the thing is, you should also do your sonography done, because fever may also give you oligohydramnios. That is, the liquid content, the amniotic fluid around the baby might decrease because of fever, because of so many multiple medications which you are taking. because of COVID. So just keep a watch on the baby movements. If you have a small Doppler monitor, you can just mark down where your baby heartbeats are felt, and you can just keep checking your heartbeats of the baby so that you are rest assured that your baby is doing well. And keep a track of the amniotic fluid by doing a sonography at least once in 15-20 days.
Thank you, ma'am. Vishnu Priya has a question for you. Hi, ma'am. I'm 18 weeks pregnant with twins, and I'm feeling pain on the left side, lower abdomen, and sometimes vaginal pain. Also, please tell me if there is anything to worry about. I'm not feeling any baby movements right now. I'm at 18 weeks.
Okay. Yeah, Vishnu Priya, congratulations for your twins. And twins is always exciting for me. It's one of the topics which is very dear to my heart. Being an IVF specialist myself, we have had lots of twins in my practice. So twins is something which always, it fascinates me. So yes, coming to your point, you have a little bit of pain. So pain could be because of excessive stretching of your uterus. So a uterus is such an organ; it's an expansible organ. So whenever it expands, your ligaments also try to pull over. So because of the pull on the ligaments, you may have a little bit of discomfort on either side of your, lower abdomen. The thing is, you have to start taking progesterone because you have a twin gestation. Secondly, you should take rest. Don't indulge into a lot of traveling. Take adequate rest. And if you feel that you get a little discomfort, you should definitely go for some tocolytic. Tocolytic is that medication which will keep your uterus quiet, which will avoid uterine contractions. Okay, so if you have to be very very sure that the pain which you are experiencing, it's not because of the uterine contractions, then you should be just take care of it. Just keep a hand on your tummy and just feel the uterus. If you feel that it's getting little bit little contracted types, then you definitely need to start a tocolytic, that is a uterine relaxant. That is a medication which your gynecologist will advise you if you go to him or her. So that is one thing. And twins also depends on the length of your cervical. If your cervical length is little shorter, then you may have to undergo the encirclage, which I had already discussed in my talk. So you can do the encirclage between anywhere between 14 to 20 weeks of your pregnancy, so that you can prevent a preterm delivery, that is a delivery during 6-7 months of pregnancy, which is little more commonly seen in twin pregnancy.
Thank you, ma'am. Ma'am, Jyoti has a question here. I'm 24 weeks pregnant, my first pregnancy. I'm not feeling any baby movements. What should I do?
Okay, Jyoti, you're 24 weeks and it's your first pregnancy, so don't worry. Sometimes the baby movements are not felt by the first time moms. So you could feel it anywhere around 18 to 24, 26 weeks of gestation. Just the thing is, if you're working, working, continuously doing your household jobs, you may not realize that the baby is moving. You will only realize the baby is moving only when you sit quietly. You sit quietly, you meditate, you just feel the baby, you just feel the living being inside you. You will definitely feel the movements, you will feel the kicks of the baby, and you will feel the flutter. So don't worry. And the first timer moms are very naive. They don't understand anything. They don't eat properly. They don't drink properly. And I know how it is, the first pregnancy. Even when I was pregnant for the first time, I knew, I really knew where I had gone a little bit wrong. So yes, during the first timers, don't worry. Just keep a track. Just lie down on your left lateral position, either ways, and just feel your baby. You will definitely feel little bit of flicker and flutter, and then you need not worry about the movements. And of course, if you feel that you are not very happy with the movements, you can always go and do an ultrasound sonography done. So the ultrasound will tell you the status of the baby, why it is not moving up to the mark. Sometimes because of less amniotic fluid, the baby you may not feel the movements of the baby. Okay, so these are a few things which you have to consider.
Thank you, ma'am. Ma'am, Sandhya is asking, due to COVID, I'm not able to go for walks. Currently, I'm doing exercises, but it is not helping my swollen feet. Is there any solution which can be done at home, sitting at home?
Okay, Sandhya, you can definitely do yoga exercises, and you can do your leg exercises, that is stretching of your legs. And whenever you, because of swollen legs, maybe you're not able to walk that well, and the swelling usually, as the day passes, your swelling also increases. So you can just get a leg massage done. You can, if you get a lot of swelling, you can also tie some crepe bandage to the legs, so that your legs get the good feel and get good warmth. And thirdly, you can also do leg elevation. That is, when you are lying down, when you are sleeping, you can just elevate your legs at a little higher position than your body, so that the edema and which you are experiencing will definitely decrease in the size. And avoid having lot of salt intake. So salt intake should be avoided. You should not have more salt and excessive salt in your food, in your salads. So that will help you to reduce the edema on your feet.
Thank you, ma'am. Ma'am, Dr. Swati has a question here. She says, good evening, ma'am. In ultrasound of anomaly scan of 18 weeks, doctor said prominent bilateral renal pelvis. Is this the problem to worry about?
How many weeks is she?
She's 18 weeks.
18 weeks. Okay. So bilateral renal, prominent renal pelvis, that is a little bit of fluid in the pelvis of the kidney, that is absolutely normal at 18 weeks. Provided it is too much of dilatation, if there is too much of dilatation, if it is more than 10 or 12 millimeters, then yes, you have to have a serial scanning of the baby, because sometimes such babies may develop hydronephrosis of the kidneys. So, and the cause has to be ruled out. You have to just find out whether there is no kidney, any congenital anomalies of the kidneys. So that is one thing which has to be taken into consideration. So yes, a serial sonography of the kidneys is important. And also in such cases, in babies who have had some kidney issues, it is important to keep a track of the amniotic fluid content and amount.
Thank you, ma'am. Ma'am, Sonal is asking, can you tell me how to increase my fetal weight? Uh, her weight is constant 59 kgs and she's in the 37th week, and baby's weight is also only 2.3. So she seems to be a little worried. So is there any protein powder or anything we can
Yes.
suggest?
Sonal, you should have at least 10 almonds. Almonds are wonder almonds. So you can have almonds every day. You can have akroad. You can have little bit of kaju. You can have good amount of dry fruits in your diet. If you are an eggetarian, you can definitely have egg whites. So basically, increase the protein intake in your food. So increasing the protein intake will definitely, because proteins are building blocks of your body, and also for the baby, it will help to increase the overall weight of the baby. So, and don't worry about the weight. The weight will be fine. For Indian standards, even 2.5 kgs is way good enough. So somewhere anywhere between 2.5 to 3 kgs is fair enough for Indian population, Indian baby standards. Most important is the baby should be healthy and it should be absolutely fine. So don't worry. Have a proper diet. Make a diet chart. You can have small frequent feeds. If you don't feel like eating lots in a particular time, you can have 2 hourly, 3 hourly, small frequent feeds, which will definitely help you to gain your weight and also the baby's weight. So proteins is one thing which I would suggest you, and good amount of you can have different salads which has consists of pulses and cereals, which will also add to your protein intake. Okay, and if you are not having eggs, you can also have paneer, you can have dairy products, you can have tofu, which will also give you the it will uh, check in your protein content, and it will add to it.
Thank you so much, ma'am. Ma'am, Fozia is asking, she's 21 weeks pregnant and she is coughing a lot. It is not going at all. So, what is your advice for her?
Okay, if you have cough for a long time, it could be allergic also. So for allergic cough, you should first avoid the allergen which is causing you the cough. So if you find out the allergen, you can just avoid going near it and avoid getting the cough, because cough will definitely instigate the little bit of, it will increase the intra-abdominal pressure. So you have to be very careful. You have to avoid coughing, especially during pregnancy. You can have some cough syrup which is safe during pregnancy. So if you are in the second or third trimester, yes, you can have a cough syrup, which like for example, whichever is available at your place. Here we have FOGSI, we have cherry cough, we have fencidil, etc., many of them. But just see to it the content. So you can just ask your gynecologist to give you a safe cough syrup which will be safe for your baby. And you can also do a little bit of warm saline gargles. If you get a lot of cough, you should have warm saline gargles. You should have uh, turmeric milk is also, it has medicinal properties. It is, of course, it is ghar ke nuske, but yes, it definitely helps, because especially during pregnancy, you can't have a lot of medications. You can't load yourself with antibiotics. So you need to have some, you can have some simple kada which will be useful for your throat, because cough is basically it's reflex. So you cannot control it. So you can control it by avoiding the allergen, by avoiding the thing which is irritating your throat. Okay, and the thing is, drink warm water, which will definitely have a soothing effect on your throat. You can have some important lozenges, like you can have coughlets, you can have strepsils, you can have some you can have these lozenges which will help you to soothe your throat and avoid the cough. And of course, if still you are coughing for a long time, you can definitely show a pulmonologist, so that some other causes of your cough have to be ruled out, especially if it is for a long time. It should not be because of tuberculosis, that is TB. So this is just an example which I'm giving you. So just be careful, and especially now during COVID times, fever, cough, cold, you have to, they are all warning and red signals. So please be careful, especially during this time. Wear a mask. Simple things. Always wear a mask, so that you don't spread it and neither you get it.
Thank you, ma'am. Ma'am, Niharika says it is why I'm in the first trimester, 10 weeks with twin pregnancy, experiencing a lot of vomiting and unable to eat wheat and vegetables. Is it okay?
Yes, Niharika, twin pregnancy again. So it is liable to happen that you feel more nausea and more vomiting during your first 3 months of pregnancy. So if even if you are not able to eat wheat and vegetables, you can definitely have fruits. If you like, you can have different amount of fruits. You get good fruits nowadays, so fruits is fine. You can have whichever suits you. You can have dal, rice, simple. You can have khichdi. So even if you are not able to have chapatis, that is wheat, that is okay for because this nausea vomiting won't remain for a long time, I assure you. So, and of course, if you have this nausea vomiting, you can definitely have doxylamine succinate, that is doxynate or Wormsick, which will help you to relieve of your nausea vomiting. So I feel whenever you have this problem of nausea, you should take your medication and not torture yourself कि हाँ वो feeling आएगा उसके बाद ही मैं खाऊंगी, because that is really silly. So if you start getting nausea, vomiting, then obviously you will have to vomit. So instead of getting tortured, you first take it. You just take it. Even though you don't have nausea, vomiting, you will not suffer that. So that is one thing which I usually advise my patients, especially in twin pregnancies, because they suffer a lot because of high HCG activity. They also get a lot of nausea, vomiting. So this is one thing which you can definitely advocate. You can take doxylamine even though you feel good, so that you feel better and best, and then you don't have the problem of nausea, vomiting.
Thank you so much, ma'am. Ma'am, Achla is saying, as soon as I eat something, especially fruits, there is some baby movement below the belly button. Is this baby movement or something else?
Yes, I think your baby loves fruits. So I think you should have more fruits, Achla. And it's absolutely normal. The baby has the whole universe. It's the uska universe is in your uterus. So yes, it will move, and I think it's absolutely normal. Nothing to worry. So I think it's fond of fruits. Good.
Thank you, ma'am. Ma'am, Isha has a question for you. You were saying, C-section or normal delivery is a common query. So Isha is 28 weeks pregnant. She says, in my 19th week scan report, I'm having low-lying placenta about 7 mm from the internal OS with cervical length of 5 centimeter. Internal os is closed and I have cyst in the left ovary 7 into 5.7 into 5 centimeter and cervical fibroids 38 into 32 mm. Ma'am, please explain to me my case as my doctor says everything is fine. Can I have normal delivery?
Isha, yes, you have a cervical fibroid, as I just heard from Ansuya. See, a cervical fibroid is a detriment sometimes for a normal delivery, to be very frank with you. It also depends on where exactly it is located. If it is bang located on the external os, means jahan se baby bahar aane wala hai, so yes, then it could be a little bit of a hindrance factor for the baby to come out, and it's a little bigger. It's around 3 by 4 centimeters. So usually they tend to increase during pregnancy because the fibroids get lot of vascularity, lot of blood supply, because anyways the uterus and the cervix have good vasculature. So the fibroids may increase maybe by few millimeters by the end of your pregnancy, that is in the 9th month. So it also depends on the exact locality of the fibroid, the size of the fibroid, and if it is hindering the normal passage of the normal delivery, yes, then you may have to go for a C-section if the fibroid is causing a trouble for the normal delivery. And regarding the cyst, you need not worry unless you get pain. I just heard you have a huge cyst by 7 by 5 something centimeters. But yes, the cyst will not cause any detrimental, it doesn't have any detrimental value. So be rest assured about the cyst. So yes, that is about the cervical fibroid. And placenta, you said? Placenta? Yeah,
Yes,
placenta
low
7
line plus.
millimeters. It is low lying. So yes, it also depends on the placenta, because if the placenta is coming in the way of the delivery, then you may get bleeding. So your gynecologist will advise you accordingly that whether going for a C-section will be a good option for you and your baby.
Thank you, ma'am. You've patiently answered so many questions. I'm going to just ask this cute question. So, Anjanea says, my wife is 22 weeks pregnant. She is always feeling hungry. She's already overweight. If she eats like this, she will gain more weight. So,
Oh.
because of the weight and low-lying placenta, doctor suggested don't do any exercise. Please suggest how to reduce this hunger.
Mm. I know you feel very hungry during pregnancy. You know what I used to do? I used to get up in the night and eat. So my husband, he he got a fridge next to me. So जब भी भूख लगे उठो और खा लो और सो जाओ. So yes, I know how it is. Hunger pangs, you really feel pregnant, and when the baby is demanding it, you really feel pregnant. You really feel very hungry. So the thing is, you can have something which is nutritious and will not give, have a fattening factor. So you avoid having junk. That is most important, because junk is not going to lead you to anyways, and your baby will also, once it is born, it will also demand for junk. So don't eat junk food. That is most important. Don't eat hotel food, because you don't know what oil they have used, what contents they have used. Chinese may contain ajinomoto, which is not good for anyways for a normal person. So rahi baat a pregnant lady ki, so no for hotel food. You can cook Chinese at home, whatever you like. And avoid having fried food, which is really really fattening and has just 0 calories, and it will not help you, neither your baby, to gain weight. And your baby will also see, what is Garbh Sanskar? What is, whatever you eat, your baby will also eat when the baby comes out. And then the baby will also demand the same thing. So if you give good Garbh Sanskar of food values, intrauterine, that will also help the baby when it is a toddler. So you should eat healthy food. So then you will not, increase a lot of your weight. And since you're already, I guess, 22 weeks, this is the time when actually the growth of the baby occurs, and you also feel hungry. So the thing is, if you have a low lying placenta, you can just do a little bit of breathing exercises, not too much of exercises which are causing intra abdominal pressure. So breathing is fine. You can do stretching, so that you can do simple stretching exercises, which will again help you to, not become a couch potato. And of course, it will help you to become swift and little active during pregnancy, because the way you are, the way you behave during your pregnancy, it definitely affects your baby's growth, and the way your baby is nurtured. So I think it really has a big impact value on the baby there inside. Don't you think that अरे baby को कुछ नहीं समझता? It's not like that. Your baby is very very intelligent, especially the Gen Next babies. They'll just come out with mobile in their hands. So just be careful.
Thank you so much, ma'am. I think that was a very interesting concept of, Garbh Sanskar diet. So I think we've come to the end of the session. To all the users, I know we tried a lot to answer all your questions, but then there are a lot of pending questions which you can post in the feed section, and one of our experts will revert within 24 hours. And Dr. Aditi, thank you so much for joining us in these difficult times. And we hope to have you back again. It was such a great
Yes,
interaction.
I would love to. I would love to, Ansuya. Thank you. I also enjoyed a lot. And thank you for the opportunity. Thank you, Dr. Jaideep Malhotra, ma'am. Thank you, Niharika. Thank you, Ansuya. And just let me know if anybody has any more queries, I would love to answer them. Thank you so much.
Thank you, and have a great evening, everybody.